As maternal mortality rates continue to rise in the United States, Maternal Mortality Review Committees play a vital role in examining ways to prevent future cases from occurring. Maternal Mortality Review Committees identify and recommend strategies for eliminating preventable maternal deaths. What are the steps to establishing a review committee? To establish a Maternal Mortality Review Committee, you need to ensure protections are in place, identify stakeholders and select membership, define scope and reach, determine where the committee will live, define a process flow, and implement and evaluate your efforts. Step 1. Ensure protections are in place. Access and protection are key factors in conducting a thorough review of cases. To ensure a review is comprehensive, committee members must have complete access to data sources, and information collected must be protected from disclosure. Additionally, review committee members should have legal protection from subpoenas related to their participation in case reviews. Step 2. Identify stakeholders and select membership for review committee. When reviewing maternal mortality cases, it's important to have a diverse review committee that represents multidisciplinary backgrounds. Review committees should be composed of state and local organizations such as health departments and state OB/GYN societies, medical and social service providers, and other community stakeholders. Committees should have a chair to provide overall leadership and vision for the committee member subject matter experts to inform the case review, and support from abstractors, coordinators, epidemiologists, and database managers. Step 3. Define scope and reach. Maternal mortality review committees need to decide on the scope of their case review. The members of the review committee will ultimately decide which cases they will or will not review. Step 4. Determine where the committee will live. Review committees must determine where data and administrative responsibilities lie, determine who has responsibility for collecting and reporting data, and who has responsibility for scheduling meetings and communicating with members. Step 5. Define process flow. In order for review committees to examine maternal death cases effectively, processes should follow a defined flow. 1. Case identification. First, cases are identified through vital records, hospital reporting, media, and/or word of mouth. 2. Case selection. A subcommittee may be put in place to review cases and remove cases outside of the established scope of the review. 3. Case selection. Cases within the scope of review are sent for abstraction. 4. Abstraction. Next, abstractors compile data on cases using every piece of information available to them, such as death and birth certificates, autopsy reports, prenatal care records, social service records, and informant interviews. 5. Case narrative development. Finally, an abstractor develops a case narrative. A case narrative contains critical factors that answer key questions surrounding a woman's death, such as who, what, when, where, and how. How do review committees make their final decisions? 6. Case review presentation. Maternal mortality review committees make decisions based on discussions from the available case information. The review committee determines whether a death was pregnancy-related or pregnancy-associated but not related, the cause of death, preventability, missed opportunities for prevention or intervention, and makes recommendations to prevent similar future deaths. 7. Findings entered into the database, including specific and feasible recommendations for action from the committee. 8. Data analysis. Data are analyzed for regular reporting and translated for public health action. These regular reports demonstrate value and are key to keeping review committee members and stakeholders informed and engaged. Step 6. Implement and evaluate. During the review process, issues may arise that require technical assistance. Technical assistance is available to support review committees. Evaluate implementation as it occurs and make adjustments or course corrections as needed.